Good evening, everyone, and thank you for tuning in to Hotline 21 on CAN TV. This is a live call-in show, and I'm here with Andrea Moreno. We are with Beacon Therapeutic, and I'm going to give you a little bit of information about Beacon. Before we get started, we've got 4 locations, and our business office is at 1912 West 103rd Street. We have homeless outreach services, that's at Southwestern. And we also have 2 therapeutic day schools. One is a high school and one is an elementary school. And those locations are on your screen now. And we are on YouTube and Facebook. And we also look forward to you visiting our website at beacon-therapeutic.org for more information on our services. And here are some of our programs that we are highlighting: therapeutic day schools, homeless outreach services, early Head Start, children's health insurance, our family assertive community treatment, our outpatient programs, our 100,000 Homes campaign, and our outpatient services. Now, within all those services, we are featuring health education, and that's why Andrea Moreno is here with us this evening. She is the health educator at Beacon Therapeutic. And just one more thing about Beacon: we were founded in 1968, and we provide social services, special education services, mental health services to at-risk children and families. So we've got a lot going on. We've been around for many years, and we're pleased to have Andrea as a guest this evening, and she's going to tell us about her role with Beacon and the many things that she's doing within our programs. Thank you, Andrea, for being here this evening.
Thank you for having me.
And let's start out by sharing with our viewers just a little bit about yourself, and then we're going to delve into your role at Beacon and everything you're doing. I know you've got an entree of information to share with us, so tell us about yourself first.
Well, I received my master's in public health from Benedictine in December, and shortly after I got a position here at Beacon. But I've always had an interest in working with underserved populations. During my internship at St. Anthony's during my graduate career, I had the privilege of working in the Lawndale area with the lower income community. Through this, I learned a little bit about what Beacon was, how it provided its services, because I did serve some of their clientele. And Beacon has a strong history to support its mission. And it's very well respected, and I just thought it was a privilege and an honor to be part of this organization.
Wonderful. And you were telling people that you served in the North Lawndale. Was it North Lawndale or Lawndale?
No, it was the North Lawndale.
Okay, I used to work in that area as well, and I know it can be a tough area as far as people trying to find services and getting the resources that they need. So I'm sure you had your work cut out for you. You have mentioned you've been at Beacon, you're relatively new at Beacon, but that doesn't mean that you're not that you're not an expert in your field, because you do have a lot of experience in health and nutrition and in educating people on what needs to be done for a healthier lifestyle. While we're still talking about Beacon, you've seen a lot when you've been in the shelters and in the community, and what keeps you motivated? What keeps you committed to Beacon's message and mission?
That's a good question. I think it's the success stories that I hear from the other therapists, and even the success that I've seen in this short amount of time within my own participants. From having cooking demonstrations and just from seeing them prior to what they've come to before, and hearing them say how proud they are of themselves, of how far they've come in the short amount of time. I think that's what keeps me going. It keeps me wanting to do the best that I can possibly do for the community.
For learning new, maybe I should be one of those in those cooking classes. I'm domestically challenged, so this would be good. What so far do you like most about your experiences at Beacon as the health educator?
I think it's a little bit different working with a specific population, with the homeless population, rather than in North Lawndale, though they do have a lot of things in common, a lot of the same barriers. It's it's a lot different working specifically with the homeless population. And I think it's very rewarding, knowing that they definitely appreciate the services that they're being given, and they take advantage of those services, and because they do want to learn how to be self-sufficient.
Okay, well, let's talk about that. Let's delve into the programs at Beacon. We have our shelter outreach services.
Yes.
We've got our homeless outreach services. And under that umbrella, we've got a whole array of other services. And again, I'm just going to put that information up. For example, our FACT, Family Assertive Community Treatment, falls under our homeless category, and our 100,000 Homes campaign. I mean, we could go on and on. So you're seeing a lot of people. You're seeing a lot of cases, and it's got to be tough. So let's hear about your role within all these programs. I mean, you're seeing a lot of people.
Yeah,
Talk about that.
I work agency-wide, so I work very closely with all the programs within Beacon, from FACT to HUD and big and little IOP, the high school. And basically, everybody that I see is referred to me through their therapist, through their medical contact sheet. If there is found to be some medical condition that they need education around, that they're not so sure about how to take care of themselves, they would be referred to me. If they simply just need links to primary care services, and for primary care services that includes preventive care, dental, and vision, we link them.
What about immunizations?
Yes, the
that type of thing?
immunizations for the children. We make sure that they are up to date on all their immunizations, and just education surrounding preventative care. We have a lot of our population that has chronic diseases that they're not very knowledgeable about at this point. They know a little bit here, they know a little bit there, but teaching them how to treat themselves and making it important is part of it. And I also hold group sessions in some of the shelters, just basic health education sessions, to give them a little bit of knowledge about the types of issues that are going on within their own population.
How does that work? A group session in the shelter. About how many people are part of the group?
Well, I hold my sessions usually during the day. So depending on the shelter that I'm at, sometimes people are at work, but a lot of the times they are at the shelters. So I can get anywhere as few as 3 to as many as 15 people in a group.
So they have a sign-up sheet and they come, you have different topics?
Yes.
I'm fascinated by this.
No, we have a lot of different topics. Just most recently, we had a discussion about bed bugs, which is something
fascinated by that.
which is something that is very common in the shelters. And or we can talk about asthma. I have a group session coming up pretty soon that we're going to be talking about stress management, which is also a big topic, especially living in the shelters, or menopause. Smoking, definitely.
I know that's a big one as well.
Yes, smoking is definitely a big one. So it ranges from many different topics. Anything that falls under the umbrella of health education or health and wellness is something that I would be covering.
And so then you talk to people beforehand, you talk to them after, like,
Yes,
hey,
I do.
what did you get out of the class, and what kind of feedback do you get?
I usually get, so far so good. I usually get some good feedback.
That's good.
But I also do ask, how can I better improve the program, what they didn't like, so things can be changed to better evaluate what the program is and to better serve the population.
And so they could offer ideas of future topics
Definitely.
to cover.
I get that all the time. I get suggestions all the time. Every time I hold a session, they're asking me, hey, can we talk about this next session? Or can you make sure to add some more information about this? And I'm
Gladly.
gladly.
Make a note and do it.
Yeah, gladly I do.
Great. Well, how do you feel your qualifications, your talents help enrich the programs? I mean, clearly health education is a need, so.
Yeah, within Beacon, yes.
In Beacon and in the community.
And in the community, I think that knowing the physical health of a person and coupling it with the mental health, I think that better helps us to develop their treatment plans, and just to better serve them, to develop programs and to refer services to them that can pretty much aid in helping to help them. I'm sorry. To get their needs met.
Yes.
And just to better serve them as a population. I think it provides very more of a well-rounded service for Beacon, to not only help them with their mental health but also their physical health.
It's important because they play off each other.
Yes, they definitely do.
The mind, body, and soul definitely play off each other. Now, we're in an evidence-based arena, world. Everybody wants, to know where their money's going, and as they should. It's like, I'm investing in this program, I'm investing in this organization. I want to know what you're doing with my money to make sure this population is served and the needs are being met. How do you track what you're doing so we can say, hey, funder, hey, donor, hey, board member, hey, whoever, this is what we're doing, and this is why it's important, and these are the outcomes that we're getting, and this is the change that we're seeing.
Part of it is through surveys that we do, as we talked about before. I do give pre and post surveys to assess where the each participant is and their readiness to learn, and then afterwards we give them another survey or a questionnaire about what they did learn, see if anything was actually taught. And also for individual sessions, we give nutritional assessments to see where the person is.
So what entails
in the nutritional assessment?
Yeah, what does that entail?
We ask questions on the survey. Basically, we break down each meal. What is it that you eat? How often do you eat? How you feel when you eat? So we can try to see where the person is and see where we can best serve them.
Okay, that's good. Again, if you're just tuning in with us, we're Beacon Therapeutic. I'm Jenny Brandhorst. I'm filling in for Susan Reyna, our CEO and president, and I'm with Andrea Moreno. She's our health educator, and we're talking about health and wellness and nutrition in the community at large, but also within the homeless population, because that's what Beacon, one of the many focuses that Beacon has. So I'm going to, again, put up some of our programs. I'm also going to put up some of our contact information for people to write down if you want to reach us, or if you want to see us on Facebook, the website, or YouTube. You're welcome to do that as well. And again, we are discussing our health and how to better ourselves. Now, we had talked about Beacon. You're also very much engaged in the community. What types of things are you doing in the community?
Well, I do visit shelters. We reach 27 of the 55 shelters here in Chicago, and I try to keep my hand in as many as possible to provide health education services. Anytime there's a health fair that comes around, I do like to promote Beacon and its services. In fact, we have one coming up in July 21st at Chicago Friends and Family. I'll be providing as much information as possible, as I possibly can, to the public and as well to other clinics about our services.
And people in the shelters or in the community, or maybe they see you at a health fair, what types of information are you giving them? What are you telling them to do?
I'm giving them information about each of our programs, our counseling services that we have for their mental health needs, and also about the health education program. We give them information about our early Head Start, about our Big and Little IOP, about the high school, any information that could possibly help them.
Wonderful. I want to touch upon a touchy subject, but it bears bringing up. Beacon is in a lot of the shelters, and someone might pose the argument, well, if someone is homeless or homeless families, they don't have access, might not have the access to food that they need.
Yes.
And shelters are doing their best to get the food, emergency supplies, food banks, that kind of thing, but it might not be healthy.
Right.
It might be whatever they can get, and that's how it works. Or if someone is on the street, they're surely not going to be worried about eating nutritiously when they have no food. They're lucky to get a bag of chips. What can we do? What we can do about this? I don't know.
It's difficult. That is a difficult topic. I think a lot of it is much bigger than Beacon, just because, as you said before, shelters do rely a lot on donations for their food source. But the one thing that I do try to help shelter staff with is how to better or to use those resources properly. If they have only canned vegetables that they can use or limited type of vegetable, teaching them how to make it a little healthier, whether it's rinsing the canned vegetables off to eliminate a lot of the salt, or if it's instead of frying the meats that they provide for their participants, baking them. But just trying to work with what they have, because that is a very difficult topic. Even just bringing it up to the participants, they'll give you looks like, okay, well, what are we supposed to do about that? But it's working with what they have.
Yeah.
But with our housed participants, we do have some housed participants. I think it's a little easier, because they do have some more resources than our sheltered participants. And as I mentioned before, I have the opportunity to do cooking demonstrations with them. I teach them about the food plate, so that they know what a portion looks like.
What is it, like a fist is like what you
me,
want?
Yeah.
Okay. Is that still the rule?
Yep, it's still the rule. So just teaching them how to implement it in their lives and creating as much of a healthier lifestyle as they possibly can.
We're talking about a problem.
Yes.
What are some of the other problems that you're seeing? I'm sure you're seeing a lot.
There's a lot. One of the main issues that I deal with is access, or the participants deal with their access to health care. As we know, there are lots of barriers to healthcare, not just with anybody, but specifically with this population. And the main thing I try to do when I meet with a new participant is find out if they have primary care services. If they do, we make sure that they are going to their appointments and scheduling those appointments. If they don't, we link them to a healthcare facility within their area, and make sure they're very comfortable.
Is that hard to do with the linkages?
Not so much, because we have specific linkages. It makes it a little bit easier. But we're trying to increase our linkage agreements so that we have an array of facilities to share with our participants.
Wonderful. Any other problem? I mean, I know there are a lot of problems, but those are some big ones.
Yeah, and tobacco. Tobacco use is something that has been high on the list.
Actually, keep talking. I'm going to put up some information on that.
The numbers go up and down, but about 70% of the homeless population smoke. And yeah, one of our linkages, or one of our relationship, is with the Respiratory Health Association of Metropolitan Chicago.
I'm going to put some information up about that. Go ahead and
keep
speaking.
Through them, we're able to provide tobacco cessation programs, individualized sessions, as well as group sessions. And basically what those sessions entail is teaching them different coping mechanisms. It's very stressful to be in a situation like this, and the one of their only outlets is smoking sometimes, but teaching them other ways to cope with the stress, teaching about the medications that are out there, the biological and physiological models of addiction, and just being with them along the way and supporting their decision to quit in any way possible.
What are some other places that we link people to?
Okay. One of the other agreements that we have, or links that we have, is through the Comer Children's Hospital van. They provide services for our big IOP, little IOP, and the high school. They give physicals, and they help to keep their immunizations up to date. We also have an agreement with Destiny Dental.
Okay.
Because a lot of times our participants don't have access to even dental care. So we have an agreement with them that they provide preventative care, oral surgeries, x-rays, so on and so forth. And they provide blocking schedules so that our participants are sure to be seen without waiting for long periods of time.
Great. And I know there are many others that we're working with, but I know our time is of the essence. It's limited. And I want to put up just some pictures of some of our folks at Beacon who are working on getting healthy. Here's one of our students having a healthy breakfast. Here's another picture of our summer 2010 garden project, and our health educator at the time, that was Florence. She was helping people do to plant a garden and plant their own vegetables and teach about the importance of nutrition with fruits and vegetables, and also the importance of brushing our teeth and flossing every day. And it sounds easy, but it's not always when you're busy, or you don't have access, or you don't have the resources. And speaking of resources, we've got one other health resource through Beacon, and that's our Children's Health Insurance Program Reauthorization Act, otherwise known as CHIPRA, and it helps children in need, families, and adolescents who are without health care coverage to get health care coverage. So there are a lot of resources, and we can help you find them, and that's why Andrea Moreno is here with us to help with those services and those resources. I want to know your thoughts about Beacon. Okay. What makes Beacon unique? Your experience at Beacon. Why should people support agencies like Beacon?
I think what makes Beacon unique is their innovative programs. I think coupled with the promotion of empowerment and self-sufficiency, I think that's what makes it unique. I think we strive to get our participants to the point where they kind of don't need our help anymore in some ways. I think that's what the basic reward is, or the main reward is that they don't need our help anymore, and they can go out and be self-sufficient and have the life that they didn't think they could have before. And I think that people should support social services like Beacon, because we can't fight homelessness alone. We need people's support. I think Beacon provides services that are stepping stones to self-sufficiency. We need agencies like Beacon to continue to be the voice for the homeless people.
And what if, let's just imagine, we've got a magic wand right here, and we're going to pick it up. What would you do with your magic wand with health education, with social services, nonprofits? How would you make it right?
How would I make it right? I'd make sure that the population that we serve definitely make their health a priority. I think because of everything else that they're trying to combat, healthcare is on the back burner, and I think that's probably one of the barriers. And
it should be on the front burner.
And when it should be on the front burner,
if you're not healthy,
how can you
do anything
possibly else? How can you possibly step up to the plate to anything else? You need to, our population needs to make their health a priority, and I think having health education or health education services within the mental health and the homeless population services aids in making it aids in making them a little bit more self-sufficient and bringing it to the forefront.
Thank you for that. We are running out of time, unfortunately. I think we could talk forever, but we are running out of time, and I want to give you the opportunity to give any final closing remarks, comments for our viewers this evening.
I'd like to thank you and
thank you.
in inviting me here, and I just want everybody to remember the importance of social service agencies like Beacon. Not just with the health education portion, even though it is important, but with the mental health component and just providing that support that's needed. Anything that can be done for the population, I think should definitely be done if it's in our power.
Great. Well, thank you, Andrea, for being here. I appreciate your time, your talents, and what you're doing for Beacon, but most importantly, what you're doing for the people in the community and for the homeless population. Thank you for your work. And before we sign off, I want to put up some information about an event coming up. It's called Run Home Chicago. You can join Beacon's team. This event will be to help prevent homelessness. It is hosted by the Primo Center, and it will be Sunday, June 10th. And starts off at 7 a.m. If you're an early bird and want to come down to Soldier Field, join us, join Beacon's team. And we've got another event coming up, the Beacon Bash, and that will be Thursday, July 26th at Joe's Sports Bar on Weed Street in Chicago. This is another event that will help benefit Beacon's homeless outreach services. And for information on that, please contact Peggy Rourke at 773-298-6441. And again, I'm Jenny Brandhorst. This is Andrea Moreno with Beacon Therapeutic. We'll be on again next Wednesday to talk about Run Home Chicago. So next Wednesday at 4:30. Until then, have a great week.